I'd love to hear your opinion on, well, a couple things. I don't want to get ahead of myself. We didn't get into details on this, but you touched on it. Like, what other than contributing to atherosclerosis, like, are there other problems or risks associated with eating animal food?
Oh my.
I'm pretending like I don't know.
Sure, right.
Whether or not there are, but you know.
Oh, it's a vast issue. The mind reels as far as the checklist of problems with eating the animal flesh. I'll just go through several of them. You can stop me if we're running long here. But one that's very important to your situation. You know, we want that meat, want that protein, strength. Well, when people eat a hunk of animal muscle and all those amino acids hit your liver, which they do very quickly, the liver sees all these building blocks for tissue, and the liver says, well, let's build something with them. And as a response, the liver puts out this very powerful hormone called insulin-like growth factor 1, IGF-1. And this stimulates the body to grow. And if you're an 8-year-old boy or a 3-month-old baby calf, boy, yay, IGF-1, you want lots of that. But if you're an adult male with a tumor, if you're a guy with a big prostate gland, you're a woman with a breast lump, the last thing you want is a surge of IGF-1 coming out of your liver in response to this protein load. So certainly high protein diets are not the friend of the patients with a malignant disease. That's for sure.
Because that hormone tells cancer cells to grow.
It tells everything to grow. Absolutely, grow. That's throwing gasoline on a fire. So that alone is reason not to consume it. These animals in the feedlot are given hormones and growth promoters to make them grow bigger. The steers get these hormone implants behind their ear. Chickens are, in the past, have been given estrogen. They're female animals to begin with. The dairy cows are pregnant, so their milk is full of estrogens. These are all growth promoting hormones, and we're eating meat and dairy, and women are getting breast lumps and fibroid tumors in their uterus. Little girls going through puberty at age 8 and 9. No, why is this happening? They're eating cow estrogens. This is why, and it's promoting all this growth. So
the IGF-1 plus all of these animal hormones, artificial and natural.
Absolutely. And these animals are given antibiotics because they get infection, and it makes them grow bigger. And so there's always lincomycin and tetracycline and various antibiotics that do unfriendly things to your own gut flora that we're trying to cultivate to be healthy. Here we are eating antibiotic-laced chicken and even fish these days. The farm fish are given antibiotics as well. So that's pretty reliably present in the meat. The animals in the feedlot, they don't drink pure water, and there's often heavy metals in the water. There's mercury and cadmium and lead and arsenic, and that winds up in the animal's muscle as well.
And fat too, right?
And fats. These are fat-soluble substances, the Roundup and the various insecticides and pesticides. That bioconcentrates into the animal muscle. And cows get leukemia, and there's malignancy. Chickens get lymphomas, and so you find leukemia viruses and lymphoma viruses in the chicken and in the dairy products and in the meat. Good heavens, we're feeding that to our children. You know, what is that doing to their leukemia risk? You can find the DNA of the bovine leukemia virus in breast cancer cells in women.
I talk about this in my book, bovine leukemia virus.
Indeed.
In breast cancer. There's a pretty strong association now based on some recent research, and it's pretty shocking.
It is. So you're asking, so what are the problems with eating meat, doctor? Well, you want me to keep going? I mean, it's
a pretty good list, and I think
really
people watching or listening are probably like, I've never thought about. They just think about, I'm eating a piece of meat. I think, there's hormones in it, there's heavy metals in it, there's environmental toxins in it.
Indeed.
And
you're paying for. And plus you're paying for the dreadful suffering of these beautiful innocent creatures in the factory farm system, and for the destruction of the planet. Every burger you buy, another acre of rainforest goes down, another more of the water table sinks a bit lower, with the greenhouse gases increase in the atmosphere. At what point do we say this costs too much? I don't care how that steak tastes in your mouth, it costs too much. We've used it up at this point.
I know you had to talk yesterday about these things, and do you know off the top of your head, and I always get these figures a little mixed up, so I don't want to quote them, I'm hoping you know them better than me, how many acres of land and how many gallons of water, all translate into a serving of beef, or whatever it is? Or,
yeah.
I mean, how many pounds of grain and water?
Yes, right. Roughly every pound of beef on the plate there, between 12 and 14 pounds of grain went down that animal's gullet. 1,800 gallons of water. That's 60 bathtubs of water. And that for however long that animal lived, he's breathing out carbon dioxide, belching out methane, eating grains that have been sprayed with ammonia fertilizers that put nitrous oxide into the air. They are greenhouse gas disasters. That burger costs a lot more than $2.98 a pound, that's for sure.
Yeah, it's crazy to think about that much water, 1,800 gallons of water, to feed the cow. And then you said how many pounds of grain?
Between 12 to 16.
Yeah, 12 to 16 pounds of grain, right, to produce a pound of steak.
That's 12, 16 loaves of bread you could have made. Yeah, how many people could you feed with 16 loaves of bread, versus 1 pound of steak there? Yeah, because most of the grain that goes in the mouth of the animal, the back end is manure, or he burns it off walking around as heat, or it turns into bone and blood and hair and hide and things that people don't eat. The amount of actual muscle you get is very small compared to the energy that went in. It's just a bankrupt system.
Yeah, 12 to 16 pounds even just of oats.
Yes.
That would be breakfast for me for like a year.
Really?
A year's worth. I buy oats by the pound and it lasts me like a month.
Exactly.
And I eat oats for breakfast every day. And it really is pretty mind-boggling when you sort of break it down and see how many resources go into producing animal food, especially beef. I understand some animal foods are more economically sustainable, but anyway,
we should be using that land and water to grow food for people.
Yeah, grow grains, directly. Grow fruits and vegetables.
Exactly.
Okay, thank you, because that was I love your answer. I love what you said, and I think you explained it in such a simple way that a lot of people, the wheels will be turning.
Good.
Right?
That's the object of the exercise.
Yes. Now, let's see. We covered fasting. We covered the problems with eating meat and dairy. I'd love for you to talk about the latest dietary fads, the ketogenic diet, and now the next step, the hottest new fad, the carnivore diet.
Carnivore diet.
And you don't have to talk about both, or you could. I'd love to hear your opinion on either one.
Sure. No, I'll be glad to share both.
Because we know ketosis is good in the context of fasting.
It is, correct. And ketosis is this remarkable state that the body goes into as it's shifting from burning sugars, which really is our daily fuel. We are carbohydrate burning creatures. Our mitochondria burn sugars, not fats. We really do want to be burning sugars, but if they aren't around, then the body will metabolize fats, and one of the breakdown products of the fat molecule is these small little acidic molecules called ketones. And so they're in the bloodstream when you're metabolizing fats. And the ketones have some interesting properties. One, they suppress hunger. Yay, that's very nice. And they give chemical signals to the body to turn down inflammation. They don't want to waste energy radiating heat off to the air. So inflammation recedes during a fast, and we take advantage of that. And the people with the hot inflammatory diseases, that's a good thing. And the ketones signal the cells to produce molecules called sirtuins that turn cancer growth off. If you're starving to death, the body doesn't want to waste energy running a cancer. That's a waste of energy. So the sirtuins turn the cancer off. All these wonderful things happen during the first 5, 7, 10 days of fasting. And I think everybody would benefit from once a year, twice a year, spend 5 days in ketosis, 10 days in ketosis, and let your body clean itself out, and you realign your relationship with food. It's a wonderful thing to do. And that's the nubbin of the phenomenon, that a time in ketosis can have some beneficial effects. But we're Americans, right? And if a little is good, more must be better. Ooh, if 10 days in ketosis is good, well, how about 20? How about 30? How about 6 months in ketosis? Oh, I can beat that. How about a year in ketosis?
The rest of my life.
The rest of my life. And that's where this has spun itself into. Well, your body's got something to say about that. The ketosis is a good thing for a short period of time, but ketones are acidic molecules. This is an acid load. This is a state of low-grade acidosis, and your liver's got to deal with these acids. Your kidneys have to deal with these acids. Your bones have to deal with these acids, and there are going to be changes. There probably not all of them are good. Whether it's going to make you lose bone density, whether it may set you up for fatty livers, and high protein diets are hard on the kidneys. When all those amino acids slam into your glomeruli, into your kidney filters, it hurts them. It makes the kidney go into the state of hyperfiltration, and it's stressful for the kidneys. And these high protein diets are, I think, a ticket to the dialysis machine. And the body wasn't. Yeah, it's similar to driving your car and you're on the freeway and you come up behind a truck and you want to pass the truck and you pull out and you hit the accelerator, passing gear, and you hit that special gear and you pass the truck and you pull in, yay, good, passing gear. But you don't want to drive from LA to Seattle in passing gear. You burn out your engine, and to stay in ketosis week after week after week, man, then this is hard on the machinery. And one question is, if someone's got a cancer, as the months go by, could this constant acidosis, could this change in the biochemistry actually weaken the immune system and allow the cancer to grow even more? Nobody's done this. Outside of the so-called vegan keto program, which we can talk about, this program, one way or the other, involves packing your intestines full of fat and meat and protein, 2-3 times a day. And well, that to me is a recipe for colon cancer. That's a recipe for clogged arteries, heart attacks and strokes. It's a recipe for dementia as you tear up the brain blood vessels. What kind of microbes are going to spawn in your gut? Are these people setting themselves up for colitis, for Crohn's disease, for kidney failure? There's a high-fat diet makes people insulin resistant, and you might have type 2 diabetes. This is not a diet of health. Now, people get an initial improvement because they lose weight initially and they feel a bit better when they stop the oil and the dairy and the flour products. So, see, you lost weight, your diabetes, your numbers got better, yay, keto, stay in keto permanently.
And inflammation can go down.
And inflammation can go down. But in my lectures to the doctors, I say, do not be seduced by these early changes. It's largely just due from the weight loss. But as the weeks go by, you'll find is you've been putting diesel fuel in a gasoline-burning engine. We are not carnivorous apes. We are not flesh-eating simians. We are plant-eating creatures. When you look at it, we have fingers, not claws, on our hands. We've got these long intestines. We've got basically the same digestive system that our gorilla and bonobo cousins have, and they're up in the trees eating leaves and fruit, and we are basically plant-eating hominids, and we violate that natural law at our own risk. And I think these people are setting themselves up for an epidemic of serious diseases. But given how fragmented the medical system is, where you often don't see the same doctor when you come back to the clinic, the patients move away, doctors move away. It's so fragmented that the doctor who sees them at one point says, oh, you should be eating keto or you should eat paleo, and the patient does that, and that doctor is long gone. I say, the doctor who made this dietary prescription, you're going to be around in 10 years when this guy passes his first bloody stool from that colon cancer that your diet initiated. You won't be around to see that. You're going to be around 15 years when this lady has her stroke from that carotid plaque that your meat-based diet spawned in her carotid artery. You won't be around to see that. You're going to be around in 15 years when this guy's joints light up from the inflammatory arthritis from his leaky gut that your diet spawned there. You guys won't even be around to see it. You think you've done something good for these folks. But this is drive-by dietary advice. Nobody's done these diets for 10 years, for 20 years. They have no idea what they're really talking about. People have done blue zone diets, plant-based diets, for centuries. We know that a plant-based diet is compatible with long life. But talk about a fad diet. But as I said, the people dispensing this advice, I think they're amateurs, and they really literally don't know what they are saying. Nobody does. And I have great concerns about people following this dietary advice.
I read an article recently, and this was a medical doctor interviewing another medical doctor who is now championing the carnivore diet, and he has been on it for 1.5 years. And I'm just like, 1.5 years? That's all? Like, that's not very long to be a Mr. Keto MD or whatever, carnivore MD. I'm not going to name any names, but yeah. And so it is shocking what a short time span. I mean, this is such a short fad anyway, but people are instant experts at it and telling everyone else to do it with no long-term studies, no populations in the world that eat this way. And the same people who say that are like, oh, you can't trust observational studies. They're inherently flawed, blah, 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 blah. And, you just need to do what I'm telling you to do.
Right. Well, I'd like to know what he's brewing up in his colon wall, and what's the state of his arteries, and what's happening in his prostate gland. And
it'll take some time for those things.
It'll take some time. It's going to take a few years, but it's a pretty safe bet something's going to happen to that man's health. I don't wish it on him, but boy, he's waving that red cape in front of the bull with that kind of diet, and that bull's going to charge. And one day he's going to pass that bloody stool, or get those sore joints, and he's going to be the sorriest man in town. And he's going to say, what did I tell all these people to do? And it's do no harm applies to dietary advice.
You talk a lot about sugar, oil, and salt. And we know that the standard American diet, the Western diet, is loaded with too much sodium, too much fat and oils, way too much sugar. But I know there's a community of plant-based eaters that are also SOS free, so they avoid those things too. The question I have for you is, what would you say to someone who says, well, if I read the China study and I read the Blue Zones and I look at some of these wonderful observational studies, I look at the Adventist health studies, and the plant-based eaters have exceptional health and long life, but they're not necessarily sugar-free or oil-free or salt-free. They keep it pretty low. I know there's a gray area there.
Right.
What are your thoughts on that?
Right. Well, my gray hairs put me in the gray area there because I'm in that area.
I mean, are they as big of I guess the question is, are they really as big of a risk for someone eating whole food plant-based as they are for someone eating just junk?
No, in directly addressing that issue, no. I think the whole food plant-based eater is leagues ahead, regardless just from the nature of the food stream going through his tissues there. If there's a little bit of added salt or sugar, I don't think it's going to make any long-term difference at all. Plus, as Dr. McDougall says, all this food has all this wonderful value, but if the person doesn't like it, is not going to eat it. And if a little bit of salt, a little bit of sugar makes him eat the food, it definitely does the job there. And again,
I appreciate that. Yeah. I know people they can really get hung up on the little things. Yeah. Something I like to say is, don't let the little things get in the way of the big things.
Exactly. Don't let the perfect be the enemy of the good.
Yes.
And as the toxicologists say, it's a much less romantic image, but the dose makes the poison. And you don't want to eat sugars of food when you're eating cakes and donuts and candy bars. You're eating sugars of food. It was never meant for that. But it's a sweetening agent. Half a teaspoon of maple syrup in your tea is not going to hurt anybody. And say a little sprinkle of salt on the table is fine. But the spaghetti sauce at the Italian restaurant restaurant is loaded with salt, and you can't do anything about that. But it's okay to put a little pinch of salt right on your vegetables at the table. And a couple of drops of sesame oil and for flavoring is not going to cause any harm. But you don't want to be pouring cups of olive oil on thinking, oh, Mediterranean diet, I'm doing some hard healthy. Well, that's what it's become. So again, we're talking about flavorings here, not foods.
Yeah, that's wonderful. I think that'll give a lot of people some ease, you know, because it always bothers me to see people get so hung up on stuff that it kind of paralyzes them, right? They kind of end up in a prison, dietary prison, and then they get, almost orthorexic, right?
Exactly. Eating should not be an anxiety-producing event.
Yeah.
And like Dr. Campbell says in his book, it's the quality of the whole food stream. If the majority of what's moving through you grew out of the garden, if it's salads and soups and green veggies and casseroles and lentil stews, a little bit of salt or a little bit of sweetener, that's not going to make any difference as long as the whole food stream is whole food and plant-based.